Good morning, Bridget.
Hi, Sonia.
Hi, everyone who's watching. I'm Sonia Dolan. I'm a co-founder of Mettle Health, and this is our first mini Mettle moment with Bridget Sumser. And I'm hoping she's going to introduce herself, and then we're just going to talk a bit about what Bridget does and what lights her up. So, Bridget, I'm hoping you can introduce yourself.
Yeah, so nice to be with you this morning. I'm Bridget, some clinical social worker. I've been working in palliative and end-of-life care for about a decade, and I wear many hats these days. But the primary one I'm coming to you with this morning is as a counselor with Mettle Health. Yeah, happy to talk about more of that through other questions. Let's jump in.
Great, let's do it. So one of the things that I think a lot of people may not understand out there in the world is what a social worker does. And maybe you can also talk about the difference between a social worker and a licensed clinical social worker, just so people know the difference and where they might find those people.
Yeah. So social work is a super generalist field, which means depending on where you're interacting with the social worker, you might have a really, really different experience because often our scope of practice and our jobs are defined by the institutions with where we work. So a social worker in a hospital versus a social worker in a community setting versus a social worker in private practice or an organization like Mettle are all going to come providing different things. Some of the things that we share, no matter where you're meeting with us, is training, education, and real loving interest in whole person well-being. So we're really taught to think about folks in their life, in their environment. What are the different things that are coming to play that are bringing you to me right in this moment? And the other kind of really essential pillar is that we're strengths focused. So instead of thinking about, we may think about what's not working, but we're really oriented towards thinking about like what gets you through hard times, what are your interests, what makes a good day, because we want to help people feel connected to their power and to themselves as they navigate adversity. A lot of the times you're coming in contact with a social worker when something hard is happening. Um, you know, variation between like social worker, licensed clinical social worker, like there's a lot of difference in state by state. There's social workers with bachelor's level education, there's social workers with master's levels education. Generally speaking, an LCSW or licensed clinical social worker has been in practice for a set period of time with a pretty solid foundation of clinical work, meaning therapeutic work of some nature, has passed an exam and is able to practice independently. So I have an LCSW, which means I can practice as a psychotherapist because I've had enough training and experience to do so.
Wow. I always thought of the social workers when I first started working at hospice as the people who did everything. Like there were forms that had to be filled out. There was emotional support for the family. There was thinking through all these different areas. And I thought that was pretty amazing that social workers cover every aspect of the life.
Totally. Like, thank you for bringing us back to that point, which is, I think, something that I certainly know as a social worker is like, we can want to get into like deep emotional, psychological, relational stuff. But if the house is on fire, you're not going to do that. Right. And so social workers are pretty uniquely equipped as mental health providers to also help with concrete things, to make sure to look into resources, to connect you to stuff that you need to help you go through those processes, really as a foundation for getting into bigger, more existential things. It's really like a Maslow's hierarchy of needs, right? Like if there's not enough food, we're not going to talk about what's really sad. Similarly, like if you're nauseous, not going to talk to you about like the meaning you're making of what's happening in your life. Like really think about like what's happening right now. Who are you in this moment? How can I really meet you in what's important to you and support you from there and then see where things go?
Yeah. I mean, I feel like you probably almost just covered this in the description, but like, what does a normal day in your life look like?
Mm, it's looked so many different ways in the, you know, time that I've been a social worker. I've had periods where I spent all day, every day in the hospital, seeing people as a part of a inpatient palliative care consult team. Um, at a certain point, my work broke off to be both clinical and project and education based. So I'm very much a clinician and a therapeutic practitioner, but I'm also an educator. And so have spent a lot of time writing, crafting curriculum, teaching, training people how to be in palliative care spaces. And these days, I wear even more hats in more places, which is one of the most amazing things about being a social worker is that it's a training and a license that works in a lot of different settings
Yeah.
and really can work with anyone at any time in their life.
Yeah. Just hearing
Um,
you do that list makes me, I always feel grateful that you're part of mental health, but just hearing that list, I'm like, wow, yeah.
oh, yeah.
We're so
Well, I feel
lucky to
grateful to
have
be a
you.
part of mental health. I also just feel like so fortunate to get to be in so many spaces because
Yeah.
it's so satisfying for
Yeah.
me and stretching. And also, it's like, for me, I love being with people one on one. Like,
Mm,
it's certainly on some level, I think something that I was really kind of born to do. And the way that I make that sustainable for myself is by, you know, kind of sitting with and composting all of the things that I learn and I feel through those interactions and getting to do something more with them by
mm,
training other people, by thinking hard about what these transitions mean in our lives just as human beings and like how do we support one another
yeah.
through professionally but also personally, right?
Yeah.
This is all such personal work.
Yeah. And that kind of leads to my next question, which is within this day and all these different settings that you're in and all these different things that you're doing, I imagine there's lots of just mundane stuff you got to work through. And then where are the moments where you're like, wow, I love what I do?
Mhm.
Where do those happen?
Yeah. You know, the only thing that I find mundane is responding to email. Like, which
I
I'm
get
not
it.
the best
Yeah.
at.
Yeah.
You know, it's like not my strong suit. Everything else is like has the capacity to just be so striking in
Mhm.
like the most basic everyday way to the most profound way. And you know, whether I'm sitting with somebody as like client and counselor or mentee and mentor or mentee and mentor or um, facilitator or teacher, like whatever the role, there are so many moments every day where something someone else says hits me in a place of like, oh, wow, great. Like we're here and have this amazing invitation to be connected and to see one another, right? Like for me to be seen as much as for you to be seen and vice versa, right? Like I don't think of, and I have never related to service work or care work as like a one directional from me to someone else. Like
Mm,
I'm learning constantly about resiliency, about joy, about sadness, about what it takes to get through a day.
mm,
Uh, and so it's hard to pinpoint those moments, but certainly some of the most special are like sitting with somebody who's just shared something that's really important to them and feeling that,
mm.
right? And getting to have that exchange of like, wow, like what, how does that, like, just wow.
Mm. Ah, I love hearing your stories of your interactions because they make this work a little more real for me since I'm not able to meet with people. So I always love hearing how they go for you. One thing that I
It's so amazing what can happen between two people that don't know each other.
yeah,
Like the
yes.
like the stranger intimacy, or the important stranger, I think, as Lady Bird sometimes talks about it, is just like, yeah, we can be so important to one another in these like brief, in the setting of an entire life, in this brief encounter. And like, what a privilege.
Mm, mm. Well, we can end it on that beautiful, beautiful note. Thank you so
So
much,
nice to meet
Bridget,
you.
for
Yeah,
hanging out with me and answering some questions about yourself.
totally. Always. Thanks, everybody.